All right, so today it's a scoliosis. We're supposed to have that scoliosis lady with the S curve, but for some reason she's not here yet. So we're just gonna talk about the scoliosis. Before we're gonna start talking about scoliosis, I want to talk about this class, which is gonna be in September 21st and 22nd. It's gonna be manual therapy, which is manual therapy for medical massage and physio massage. We're going to learn supine and prone position, basically the whole body, where you apply it, why you apply it, how to identify the issue in the body, what are you looking for, and of course try to treat it, try to reactivate muscle, understand weak muscle, understand the unbalance in body. This is our class. So we also do assessment. Sign up with a Patreon. It's a free membership. Also, we have $5 supporter, which is give you a lot of information. A lot of classes is going to be on Patreon. This is the 2026 the way to learn. You find those professionals, people who get the business, who's growing their own massage business, and learn from them how they get to the point they are right now. This is the way to learn. And as you can see, LifeRx has been really a long time in Los Angeles area, which is really hard to like massage business in California is in general, it's really hard to grow and navigate. But we did it. We go through all these problems with all this California, what we're going to say, restrictions and business restrictions, but we're here, we survive, we still running, we still try to help people. This is what I want to say. It's usually, it's irregular spine curve. And it's two type of spine curve. It's a C curve and S curve. So the C look like this. And C, it's something like that. So this S curve, it's more, I don't want to say dangerous, it's more need to be learn about that and treat with a professional. C curve, you understand, it's this group of muscles. If we put the two muscles on the spine, as you can see, like right in here, let me get that movable spine, because this is the Chinese skeleton, he's not move a lot. This is American style, I mean American made, and this one is moving. So this is the S curve. You can see it like S curve, it's C curve, sorry, C curve. So right here, what's happened with this group of muscles? If we, let's say even that longissimus muscles or they just become like right here, right? They overload this group of muscle. This muscle on the side, they're gonna weak, they're gonna overstretch, right? Because they go around that spine. So this muscle is short. And what you guys going to do in this case? If you see the C curve, how are you gonna work on that spine? Do you have any idea which way you're gonna go? Which?
Work on the right one to loosen it up.
Okay. Yana says, I will probably work on the right side. Why not? Why just work a little bit on that spasming muscle? Any other suggestion? Any other idea?
You're going to close those openings on the top, the vertebrae, if they're too open. So
Okay.
So you have to do that raising thing when you're going up to close it.
Okay. David says it could be the spine is open, the facets. Yeah, it's right. Yeah, they're always with the spine, a kyphos or lordosis, all those facets, it's too jammed, they too locked together, or they too loose. But what I'm thinking, yes, I will probably work on that spasming muscle, just try to release. But main idea, I want to push that spine this way. I want to more move that spine to create that curve, and I want to do this with my manual therapy and also give him some homework with the bands to do so. And this is the C curve. Like I said, I love C curve because it's easy to work on it, it's easy to understand. S curve, it's a little bit difficult because the all different group of muscle, it's going to be different. Like let's say if it's a C curve, which is go like that, it could be this muscle is tight right here. I mean, they over contracted, And this one, let's say this is gonna be like a lumbar area right here, and this is gonna be cervical or cervical area, this muscle, right? So you can see it. This one is gonna be overload, and that one is the same. So you can see it's like a zigzag. If I'm going from here to here to here to here, this is how I'm gonna treat that muscle. So, and what I'm looking for, I'm always looking for tree position. When I measure the person, I'm looking for tree position of the measurement, or see how the person it look like with a standing, sitting, and lay down. So why we're doing this? Because I'm see how the foot and hip affect the foot affect that scoliosis. Because, and when I'm sit down, it's no more standing, it's no more ankles, and it's like, yeah, it's a different gravity on your spine. See how it's changed, and sometimes it's really changed. You can see the person standing up, it's a different scoliosis, and person stand out, it's a different scoliosis, and when person lay down to take the gravity away from the spine. So this is what I usually do, and like I said, I'm always work on that, try to move that spine. Take a spasm away from this muscle. Yes, it's a good idea. It's help the client. It's make him feel better. What's the problem in this one? What I see the people, a lot of they go to the gym, and they always get the pain. The scoliosis, this is a message to people, to client, if you do have a scoliosis, you can't just do like a regular exercise, because when you load it equally on that spine, you're going to feel pain all the time. Let's say I get S curve, and I'm going to do some regular exercise, what people do, like a squatting. And if I don't do any correction exercise, if I don't work on that weak muscle, I'm gonna mess up myself. I'm not gonna be in pain. So this person who's supposed to come in, she just kind of prove my theory. You have to do specific exercise for scoliosis before you go and do any fitness or whatever gym. And what she do, she always go and do some weightlifting, and she always, after the gym, she feel worse because she's trying to do like everyone regular people do, but she have a scoliosis and she never treat that scoliosis. That's why you do specific exercise. You uneven your hip, sometimes you do sitting exercise. You place something under like hip and make it, if I'm scoliosis right here, this is hip high, what I'm doing here, I'm trying to get that even. My hips, I always check my hips. It's always you check the hips, the level of the hip. And that's where you do those loading those muscles, those weak muscles, and of course, like I said, Yana, working on those spasming muscles. So if this is the, like I said, C curve, it's understandable really quick. I probably push the spine this way, open, release that tension up here, try to move, give him some homework. Let's say, I don't know, pull the band from that side to activate which muscle? This one, right? To the left side. Is that correct? Mm-hmm. Are you guys with me, or are you in the phone? You see, this is what's the difference between passive learning and non-passive learning. When this is our society problem. Everyone like try to do many things at the same time. Yeah, multitasking.
Passive learning.
Correct, passive learning. It's on the phone, or someone's talking to someone, and after people come out from the class and just like, did you learn something? Maybe, I don't know. It's kind of stuck in your head, but maybe not. So that's what I'm really pleased when I go to the school in my ages. Like, I mean, there was like 15 years ago, would take all those classes. It wasn't no phones. Everyone listening. Now I go to the class. Everyone. What do you try to find up there in those phones? What's the most important up there? It's a nothing up there. It's just distract you. It just pull you away from who you are, from your target. And this is really my phone. I always put it away. I check my phone every like maybe 2.5, 3 hours. Make sure it's like client call. I need some answer to questions. but it just truly make me distracted, make me dumber. I'm serious. It's make me dumb because yeah, especially with all this AI now, you just ask him and he do it for you. But is that right or is that true what he's saying? Well, what is information coming from? At least the people my age, like I'm 50, so I'm 49. So I know because I read the books, I know what's going on, and if some information come to my way, I understand this information and I'm saying, oh, okay, this is great. But for the new people, is that the right information? Is that the true information? So everyone can apply something in the internet right now, and the AI can repeat that. So it's really dangerous. You need to filter information and really pay attention what you're doing. So scoliosis, it's all different group of muscles. It's not just and
A lot of imbalance.
imbalance. Yeah, it's imbalance in your hips. That's why we do measurement in three stages: standing, sitting, lay down. See how's everything change because the gravity on the spine go differently, and it's all different muscle imbalance too. Usually it's a S curve. Like I said, it's a zigzag. This is weak. This is overloaded. This is weak, overloaded. This is weak, overloaded. And what's most people do, they like come in and say, oh, this lower back is so like it's tight up here. And what I'm usually do, I'm not trying to start working on that loading muscle right away. I want to activate weak muscle. We don't want to stretch that load muscle because if we stretch the load muscle, we make that weak muscle more weaker. Because if I'm stretching here, this one is start losing up too. So the idea is reactivated. And also, I always like palpation. When you palpate, you feel that muscle weak. You do some muscle spindle, muscle active. You work on the fascia. Fascia is really important too, because I believe the way you move, the brain is collected all this information, and he start building you. And to work on that fascia, working on that kinetic line, especially is going to be cross kinetic line. Those big X's in the front, in the lower portion and in the upper portion. I don't remember that. No, it's lower cross syndrome, upper cross syndrome. It's a little bit different. It's you already know if you know. I forgot the name of this kinetic line. It's just come out from my head. Let's say cross kinetic line, which is probably cross kinetic line. If you know cross kinetic line, you know which group of muscle you're gonna be work, and it's right there. Tom Meyer, I believe, great book, and it's show you exactly which muscle is. Group of muscle is going to be weak, which muscle you need to be work on it, and that's what's important is. You can talk a lot about that stuff. You can which muscle is very effective. It's going to be that QL muscle is going to be bad. The rhomboid muscle is because when you're doing that, if you say you S curve, first of all, I check my hip, the shoulder is high. You can tell this rib is more open, that rib is jammed. I'm just do one pattern. That's what the most common pattern right in here. And it's jammed. And massage and physio massage, which is what we do here, it's going to be the greatest thing for the scoliosis. If you have a kid who have a scoliosis, bring to the specialist, bring to the physiotherapist. They need to work, and it's correctable. It's another technique. It's called Alexander technique. When they put specific, it's like, I don't want to say that that mental ill people that the short, that's just, how you call that? Straight jacket. So it's one of those, yes, because they want to support this particular group of muscle. They kind of tied it up with the belts, and the child start doing exercise. He's do rolling, they do rolling on the floor, and that's correcting that spine. And I saw a lot of good effects on kids to do scoliosis. Sometimes I see this on YouTube. Oh, this is scoliosis. That's okay. Just leave it like that. For the kids, 6 years old, 7 years old, it's maybe fine. But when this kid is grow up to 30 years old, it's going to be big matter for him. It's going to be really big affect his life, his posture, his sitting. When people is with scoliosis, Just think about it. If you got scoliosis and you're going to sit all day like this, what's going to happen to you? You're going to get up and you're going to walk like that. And it's going to affect your life because it's bad. You're going to be wrecked. And the problem is with that, as you remember that our favorite jelly donuts rule, your spine is going to be messed too. You're going to, all those bulge discs, you're going to get herniation. If I'm sitting like this and there's pressure coming on one side all the time, remember that jelly donuts rule? When you squeeze from one side, the gel comes from another side. And it's going to push on your nerve. People with the scoliosis get all this sciatica, all this numbness in the hands because it's uneven muscle. It's everything is unbalanced. And like I said, big mistake. People go to the gym and start doing exercise what regular people do with regular spine. And it's not, because you need to focus on check your balance first. And you have to check with a specialist before you go to the gym and do all those exercise. Right? So
Yes, there's so many things that you can.
come over here. So we got some David, you want to tell something? We're always welcome.
So someone's got scoliosis. Also, people have combinations. They could have some kyphosis. So there's a combination where the thoracic is
In
going
different
out.
plan, in different plan, right?
Yeah, I mean, there's all these. You could have scoliosis with some kyphosis, which is the curve up here, and then you can have lordosis some, and you have that combination.
You can go here and here too in different plan. And
I've seen
sagittal and
it.
transfer plan, because we have a three plan. If you
Planes.
Planes, yeah. If you cut yourself this way and through your ears, and also that, what's the called? I think
The
it's
sagittal,
sagittal,
transverse, yeah.
transfer plan. So
So anyway, there are a lot of combinations, and so you have to take into account how to be able to figure out quickly what to do to balance these muscles. So what people have is a lot of discomfort. So it's more of a medium and long-term plan in order to remedy some of these curves in the spine. But what people want is to get out of pain. They want to get out of discomfort. And the reason that people have so much discomfort is the paraspinals, the muscles on either side of your spine, are so much stressed. They're very stressed. They're either overstretched, overcontracted. And as it goes down, it can get overcontracted here and then overstretched over here and overcontracted, and there's so much imbalance. So when people lie on their back and then you reach underneath, you can feel where the muscles on the paraspinals are giving them the pain because they're very hard. There's hard areas, there's soft areas, and then you can go and you can balance them out. So you have to fix it in all three planes. So they're lying on their back and you work from underneath. Then they go on their side and gravity is falling and you work on it that way. And then the other side and you work on it that way. And then they can go face down and you work on it that way. And then sometimes they're sitting up. So if you do all four of those planes, you can take a lot of pressure off of the vertebrae, off of the nerves, and you can feel much better.
Yeah.
It's an amazing thing, because I've done so many of those, probably 20 or 30, 40 in my life, my career. So I've seen it. I've seen it all.
First thing first, it's a testing. It's a postural assessment. I always ask the client, lean forward, and you can tell right away that spine. Some people say, I don't know how to measure it. You can measure it. We always look at those hips. We always look at the hips, that anterior sacroiliac bone. We always measure it, see if it's in one level. We measure ribs. We see. I always see how the person is breathing. I come up from the side, and I place my hands on that side ribs and ask a person to breathe and see how's that extended that rib cage. Why I'm doing that, it's also telling me which side is effective. if this is my scoliosis, which is the most cases, like 85% of those cases, I don't see a lot of people lean to the, I don't know why. It's just because most people are right-handed, or it's just the way, no idea. So I'll be honest with you. So if I'm right here, this is my scoliosis. If I'm right here, what's gonna happen? This rib is open and that they breathing. This side is not, because it's gonna be jammed, it's slammed, compressed, correct. So I'm always place my hands and person start breathing. This is already treatment. We're gonna show you on Yana, because Yana is here, so we're gonna show you this on Yana, what exactly we do. We're going to do sitting position, tests, and we're gonna work a little bit on her spinal muscle. Just, I believe she do have a little scoliosis, right? She do tiny bit scoliosis, but which is help. Okay, so we're going to prepare that station table for that treatment. If you guys any questions, please sign up with our Patreon, because this is the most, we answer all those questions. Like I said, we help you to grow your practice, to grow, help people in your area. This is why we're here. This is all about. It's so many people suffer up there. So many people don't understand what's this all about. What's the even like what's the massages? They still think it's a masseuses who just touch your muscle, oil spread, like a unicorn tear, cucumber water, and roses everywhere. No, this is the workshop. This is the repair. This is make people to maintain people and make them move better, live better quality life. This is all about. So, ask questions. Okay, so lately I've been working with a neurologist, and I follow those neurologist classes and tests, and I'm just amazing. So I'm amazed by how, like, everything can affect it. Not just the muscle, not just your postural, the visual can affect you, even smells can affect you. So what we're going to do right now, we're going to work on David. He's got that hip problems. So he can show me which one is the worst one. No, show it to me. Just raise it up as high, like.
If I raise them,
And you see, he lose the balance, right?
it's quicker than, yeah, this one's more solid.
Okay, show me the other one. So we just want to see the
other one
compare.
is better, I like that.
So you like that one?
This one's stronger.
Okay.
If I'm on this one.
So first of all, we're going to do visual. Visual. What I want you to do, you're going to get that pen in your hand and put this on the side like this. Mm-hmm. Look at your head, and look at that one. Always just look. Don't turn your eye. Don't turn your head, and start walking, just like hard, like a little bit knee, like a Martian, like a high knee. Just keep looking at. Keep looking at the eye. We're gonna do three before we're gonna go test it. We're gonna do all three stuff, three tests, three exercise. Let it go. Okay, next one. I want you to. We work on that balance. I'm usually stay behind. I put this, and it's also for the neck. I put those two thumbs like this, and I want you to, David, turn your neck and look to the my finger, and left and right. Just switch it all the time. Which one is harder? It looks like to the left is turning worse too, yeah?
Yeah. Left is harder.
Keep doing that. So left is harder. A little bit more. And let it go. Okay, next one is going to be smell. So I got this essential oil. This is a very good, what's this? Dragon blood. Yeah, dragon blood. Oof. So what I want you to do, close your right nostril because the left one is a problem. And you just breathe through your left one. Just breathe. Can you smell it?
Yeah.
Okay. I'm just go a little bit away. Can you still smell it?
Not as much.
Not as much. I'm returning. Can you smell it now? No? Okay, I'm get closer.
More here.
More here. Okay, I want you to breathe. Just smell that. Still smell it?
Yeah.
Still smell it?
Yeah, a little bit.
A little bit. But you see, I'm going a little bit away.
Less, yeah, it's less.
That's fine. Deep smell. And let it go. Okay, so now go ahead and try to do this hip again. Let's see if it changed anything.
Yeah, it feels stronger.
It feels stronger?
Yeah.
Perfect.
I'm not wavering that much.
Yeah. So stuff like that, it just amazes me. And if you guys in this 2026 want to amaze your clients, do all those tests too. Neurology mixed up with your massage therapist, and you'd be surprised because you keep people ask me questions. I keep working on that neck, and its neck is not. Its patient has come back with the neck pain, and it's like everything is working, but it's not the problem with the muscles or your posture. Like I said, it could be your emotional stuck. It could be your visual stuck. It could be like Yana. Let's step right here. Let's try to turn your neck to the left and to the right. Let's see which one is worse. Let's take your hair back because we want to see it. David, you can help us out. So go ahead, turn to your right. Look at that. You see that compensation? I always look at this. Come over here. See, you see when she's bending this way. Okay. Now try the other way. See her other way. It's
So she angles a little bit.
She's angled, but look at this. This one is good. Let's go to this side again. This is the worst too. You see, this is jammed, and head is trying to tilt it on the side. Yeah. What we're going to do for you, David is going to hold this pan right in here on the side. So you're going to look straight. Now you look at those eyes, a little bit right in here. Look at the span without turning your head. And your arm is coming, this arm is coming up here, and you start doing this. Yeah, like wrist. Like, here we go. Like moving your wrist. Like this, watch. Like, in all different ways. Try to move. Extend your arm flat. There we go. Very easy. Don't rush yourself. So we do all this kind of cool tests. Perfect. And next one, David is going to do this eye close to the eye and away. Remember? So when you start giving like double it, split it, like you said, so close to her nose.
You can see the bridge of the nose.
Where is the start double it?
She's double now.
Hi.
Her left eye it's
Yeah.
double.
So what he's looking for that eye.
Her left eye drifts out.
Okay, let me record that. Let me record this on the camera so people understand. Get me closer. So hold on, we're just gonna record that again. Don't fix her yet. Go ahead.
Does it feel funky? Hard? It's a hard feeling. So is that single there?
No.
No, it's double. Yeah. Okay, so here.
And go ahead, do some big H for her. Let's do H. So he's do follow the H. What we look how her eyes is reacted. Let me stay on the other side. Don't move your head. You see, she's trying to help her head is moving. It's hard, but this is the great stuff to work with your clients, and your client is going to be amazed how like a big difference you can make with a small exercise without touching your client.
Is that good?
Okay, keep going.
You're doing not bad. It's not bad.
And release. Okay. Next one, what we're going to do, we're going to do the same thing what we did with David. We're going to stay up here. You're going to turn your head and look at those thumbs. So left and right. So turn, watch, and let it go. So turn your head and look. Yeah, right here on on my other side. Just keep going. Try to do a little bit quicker. Here we go, quicker. Here we go. Here we go. Look at my fingers. Try to find them right behind you. Always tell your clients what you're gonna do. I'm gonna stay behind you. Okay, look at that. And let it go. Usually, yeah, people with loose flexibility, we do all that stuff. So now try to turn your head again. Do you feel better? It is the same. Just be honest. Don't.
For me, it's not noticeable. I think it's the same, but from the side, maybe it's look differently because I cannot feel it.
Try to turn to the right. Definitely big improvement right and to the left. It's better. It's better, but it still get that head tilted. What's could be effect is it could be that spine, the thoracic mobility area, the thoracic area, and it's not be just in the neck. Or we just continue and searching and try to find the issue. Okay, thanks for watching. Practice those. It's a lot of information up there now, and you're gonna have fun. Trust me. Okay, let me turn this off. So this one is recording constantly. Okay, my favorite one. It's a sitting position, and what I'm looking for. Try to relax. You see, relax. This is actually wow. Look at this. If you get closer. Look at that erector spinal right here. Look at that. You do a lot of like lower back exercise. Yeah, look.
Actually, not too many. But some, just some.
But look at this, how it's deep that spine is. You see how deep its spine is? Yeah, so this muscle is really bulky. So that spine is deep inside. So what I need to do, I need to push this muscles away to make that spine come back. What I'm looking for here, of course, I look when she's standing and when she's sitting. So what I'm looking for on that shoulder, and look at that difference, how high this shoulder is. So this shoulder is high. What's this telling me? She's doing that. So everything is jammed on that side. What I'm doing here, it's my first, I always tell the clients before, so I'm going to place my hands on your ribs, okay? I come up here, and I push it right here, and ask her to breathe. And relax. Keep breathing. Very slow, deep. Which side you feel is more pumping? Which is more open for you?
Left.
Left. Yes. So the left is better for her because she feel it. It's contracted on that side. I'm definitely gonna work on that erector muscle to push him on the side. What I'm seeing here, this one is more flatter and this is the bulky. So this is what's telling me her spine is also rotated here this way. Like I said, it's best way to do this lay down, you do the test. Like I said, I'm gonna show that sitting treatment. So it's telling me a lot of stuff I need to work on actually. Oh, it's a good case right here. So I'm teaching my clients right now. I'm gonna teach you guys what's my client do. You just look at me right now. So you're sitting like this. Go ahead, look at me. So just kind of turn around. So you're sitting right here. You're sitting straight. Now, what you're going to do? You tuck your chin. You tuck your chin down, and after you start rounding yourself like a tree under the snow. Like when the snow is coming, those trees start a little bit tilted, rounded. So you're sitting straight and you start doing this. You roll your hands on that quadriceps. You just slide under your knee. You look down, and as far as possible, you're hanging up here. After, we're gonna do a couple times like this, and you slowly come up. Stuck your vertebra by vertebra, but your head is coming for last. So when you get up, your neck is coming up first. Again, you tuck your chin, you roll down, hanging up here, roll yourself back up. After, I'm gonna ask her to start doing those motions. So she's gonna try to look up, turn. You see my arms is pushing against that knee. And if I'm turning to the left, my right arm is pushing. Here we go. I just pop. All natural adjustment. So we're going to work on that spine rotation. All right, so here we go. No, you should see because we show for the camera. All right, David is there. Hair, I usually put some little bit oil. She got so many jewelry on her. Of course, we're gonna ask clients to remove those jewelries because we're gonna work on that neck. So here we go. We take one. The golden one, we keep it. The regular metal, we not. The gold is going up, so no, I'm just kidding. All right, so I usually put tiny bit oil on my knuckles because this is what you're going to use. You're going to use this partial, so don't push too hard. And always get that table, make sure the client is comfortable, her legs is not in the air, and she's not like, so she reached the floor. So this is the 90-90. The way she's sitting, you can record that, the position of her neck, knee. So it's not too high, the knee is not too low. It's perfectly for her. It's perfectly to do those round rolling exercise. And what I'm doing here, so I'm standing on the side. Now David is going to show. Yeah, that's fine. David is. Let's not record it. So let's record this part of the. It's just. It's just a cameraman. All right. So she started. Roll down, tuck your chin, right here. Very slowly, remember? And she's tuck your head first. Tuck your head first. Hold on. You go too fast. Let me help you out. So she's right in here, and after you start roll yourself back, okay? So here we go. I come all the way up from this occipital area, and she start rolling down, and I start roll. This is, I usually ask client, stay here, stay here. You see everything, David? Can you come up from here? Like, it's a bra up here. I kind of go around, and I'm get that laminum groove. My index finger, that part is on the laminum groove, and I go down up here, stay here, breathe. What I find out is right here. It's a little bit more. I can go a little bit under the bra. Like I said, usually it's no bra. Person just holding the sheets around, so she's covered, but it's for the camera purpose. We're not going to do that. And she's going a little bit, I'm going right here and all the way down to that sacrum, right in here. I'm not coming this way, okay? I'm not grabbing here. I will let the client know. Okay, and now she's coming up very slowly. When she's come up, I'm gliding down, working on it. And look at that shoulder. Ooh, I need to work on that shoulder. Come up here, especially on that area, that hump. Look at that. You see this on the side? I can even use just my one thumb. I know it's a hair. And you can just up. See, this side is really, really bulky. Okay, and one more time. Go down. So all the way up from occipital, down. Especially work on that, stay here. If it's, like I said, no bra, I usually... This area is rounded, more rounded. I pull towards that midline. I can grab that, kind of squeeze it together here. And when she's going back, sorry, I'm going to turn my butt to you. This is what I'm using my force. And I use my body. You can see I lean with my body. I'm not doing anything, okay? And come back, come back. Come back up. Come back up. And she's go a little bit faster, but that's okay. We can do like a 4, 5, 6 times and see how she feel. So this is definitely need to be worked on. Now, remember we want to do this little twist. Again, go ahead down. Now your hands is coming like inside your legs, like a gliding down. Don't rush yourself. So remember she's more here, so I'm spending more time up here. Look at that. So you're probably going to see on the other camera. And now what she's doing, this arm is going inside. You can show this position like right here. So push it against that arm, and this one is coming up, and you look up. And what I can do, I can help her out. I can twist her here, breathe. You see when I'm on the side? Now try to return back. And I hold her, I resist her, and slowly let it go. Switch side, this arm coming inside. I usually coming from the opposite side. I hold this up here. She can do this position too. If you don't like it, go ahead. Hold on. Relax your arm. Grab behind your head. This one is actually better too. I make sure she's not twisted that hip, and she pushing down. Push your hip down, and I support it and let it go. And return, head down, and you come back up again. Come back up. And this is what you doing. She try to reach it too. Let me show you guys. If clients want it deeper, the client can reach. So when she's here, she try to reach down, and you help client get that twist. Now you can turn this way. I will show the client this way. So sit down, spread your legs a little bit more. Make sure it's standing. So here we go. That's what I'm trying to say. The knee is not to be too high or too low. Try to reach again. Try to reach down by yourself. Inside your head. And now this arm is try to reach it up here under the table. Just relax. No, this one is try to like twist, and you try to reach, like try to grab something up here. What I'm doing here, I'm standing on that side, you see, and I try to help her. Try to help to rotate, create that rotation in the spine. Also, it's great to do this in a child pose and come back up and switch arm. So this one is coming up, and I come up and I'm doing this. Breathe. Stay here and breathe. Always tell her breathe. You see, this one is support her and help her to rotate. Push down, and I resist it. And relax, switch. Try to reach another one. I'll show you. You see this one on the packs? Help her out. Push down. And relax. And she's returning. Very slowly. So this kind of exercise, and teach her to, you see the chin is stuck. You can help her. This arm is help her to, that spine is stuck up. If you come up in the back, David, one more time. Right in here. So all the way down. Let's start from the down position. So you see her tuck your chin. She's right here. You see how she read already? I grab that, and I'm doing this. You see I tuck her chin. I not let the chin is come up first. And I'm dragging down that fascia. And when she's here, I want to make sure that chest is come up first, and after its neck come up first. This is what I teach her to get that. Ooh, here we go. So I help her to make that spine is work. A lot of rotation, a lot of reaching, a lot of breathing. You can do this with the child pose. Go ahead, do sit down in child pose. Remember child pose? Child pose is go up. You don't need to take your shoes off. If you want it. I mean, it's going to be more comfortable. Okay, just drop him down, yes. So child pose. Knee out, hands together in front. This is also treatment. So what I'm doing here, I grab the butt and I drag him down. You see, when I'm dragging him down, now I'm going to work on that left side. So her left arm is coming right in here and right behind that back. I hold that shoulder, I'm support that butt so butt is not coming out, and she's try to look and look up. And now I'm trying to help her. Here we go, big pop. You see, I'm just helping her. Look up, try to turn your head too. Here we go. Push down and relax. Switch side. Let's see which side is Here we go. On your back. Here we go. Now try to turn and look. And it's telling me the thoracic is poor. You see, and she's strong. She's like, try it and like push it down and let it go. Yes, I will give her bands. I will give her bands and work with the bands. You can do some homework to her already. Let me just show you. So thoracic is bad. So we can see it. The both side is bad. Same position, yeah. Same. But this time, You get this, no, get this bands inside that one arm, this one. So I'm going around that hip. I am repeat that cross pattern. Remember that cross pattern? So I am just support her right here so she's not gonna use her hips. You see my butt against her butt, and now do this arm again in the back. But this time, right here, turn. You see what I'm doing? I can also stay inside that band too and go down and back. There we go. Look at that. Move the whole. Look at that. What do you think? What's going to happen to her? She's reactivate all this cross muscle. Because the way she's walking, she might be all this forward that left side. There we go. It's much better. And let it go. I let it go. Ooh. You see, she lost that support. Try to do it again. Try to do it again without band. See how far you go. Look at that. Look at how improvements. 2 minutes of work, it's getting already improvement for this person. Because the brain is control everything, that movements, that motor control issue. How you feel? Okay. So, look at that. Even go ahead, stand up. Stand up. It's here. Camera back. Look at that. Ooh, you okay? So here, it's already, I see improvement, but still need to work on. Let's go ahead, face down. Face cradle. Face down. And I usually put some foam roller or bolster, but I want to measure her. So I'm pointing this feet inside it, touching. I want to see the difference between that posterior sacroiliac bone right in here. I measure it. I see if it's on the same level. I also tell the clients, I'm going to touch your glutes, okay? Right in here. You okay with that? Perfect. So I let the customer know. Now, I'm not going to just grab it. So I want to issue tuberosity and see which one is deeper. So my finger is deeper. And I see my left one is way inferior. This one is a little bit more. You can see on the camera maybe. It's sometimes hard to catch. Yeah, so that's mean this side is, this ilium is higher than that one. So it's already telling me something going on. I also do some breath work up here. I like my springing rib technique. It's also great for people with this dysfunction up here with kyphos. I come up here, place my hands on the side. I'm not pushing on that spine. It's right, and she's breathing just against me. Breathe. And I ask her same questions. Which way you feel it's more breathing stronger against my arms? Which side you feel more? I'm already know which one. Yeah, which one? Left. Left, okay. Yeah, she feel left, it's good. Not shaky. And feel this loosen up. I'm gonna work on that, like I said. Put this muscle together. She loosening that. A lot of women get this weakness between the shoulder blades muscle. They always complain, and guess what people do? They start to stretch this area, but it's not, you don't need to stretch. It's already weak. It's been so weak up there. Need to help, need to reactivate. This is what I'm doing here. And working on that. And look at this. When she's lay down, that's look normal for me. I mean a little bit. You see how deep that spine is? So I come up here, find that spine, half inches away on that laminum, and I start pulling to the side. And it's going to tell me which side is, you okay? Pressure is good? Yeah, you feel pain?
No, it's tight.
It's tight, you feel it. And I ask you to breathe, and this is my speed. I'm not rushing myself. Why is everyone doing some crazy stuff like that? I don't know why it's doing. You want to move. You want a person feel that muscle is start getting better, start moving. And look at that. It's already being good. I also can tell rotation of the spine. If side is more tighter than that one, that's mean the spine is rotating, have this rotation. How to correct that? Easy too. Well, homework. It's always homework. I always give my clients homework. I working with them, I show them what exactly they have to do, and they do it for a couple days, couple weeks before they come back to me, and I say, how's that? How's the improvement? They say, wow, this is amazing. I feel so good. I don't feel my pain anymore. That's all about massage. There's no more fufu shmufu Swedish massage anymore. It's 2026. If you're on Hawaii, like island, and you're relaxing, it's nothing gains. But if you're in pain, you need to get this physio massage, and you need to work on yourself. Okay, here we go. So I work on one side. It's already been improved. Look at that. It's much way smoother, nicer. It's no loading this way. We already showed this many times. Come up on that ilium, lock it in. My arm is straight. Look at that. It's down. Hold in here. Go ahead, lift this hip right in here. She lift a little bit. She give me space. I'm grab that ilium, not with the hook, straight arm, just like that. I grab it and I lean back. Did I hurt myself? No. I'm completely, my back is straight. This arm is pushing down. This one is lifted up. First restrictor barrier. Go ahead, push it down. Push this down. She resists against me. Little click, relax, and you get to the next level. And you lean. I'm leaning back, you see. Push it down again. Let it go. Okay? This is there with scoliosis because, yes, you have to work on that side position. We can do this next time. Next time we're going to work on the side position. Now, David, show you that supine position when the gravity of the body lean against his finger.
Okay, so when someone's got pain or very tight paraspinals, like she has a lot of tightness in her back and there's a lot of areas, and you want to be able to get more movement and get all of this, softer, so I'm gonna show you what I would do if I was gonna work from underneath her body when she was face up. So imagine that she is face up and my fingers are going underneath her body like that, but I'm gonna show you what I would be doing from underneath her body. So these muscles and all this tightness would be falling away from her body this way. So I'm going to go into here and I'm going to get movement in all of these paraspinals in here like that. And I can feel just where it is, where the problems are, like in here. Do these feel like tight areas for you? Yeah. Yeah. So in here, so this way, so when she's lying on her back and I reach my fingers underneath, I can feel where these muscles are gripping, and I can get movement in muscles that are overstretched and muscles that are too contracted. So I can feel it here, and then you can also go into here.
Now you want to flip her?
For people who have kyphosis, for people who have scoliosis, lordosis, back pain, whatever, you can find where all the troubles are. It's easy to find, and that's the main thing. I need to warm it up and find exactly where it is, and I need the muscles. I need the muscles to be away from the nerves. So her nerves are higher up and the muscles are falling down. And I'm going to go into here and I'm going to find it in here like that. And I can feel where it all is right in here. So you can feel the entire thing very easily, and you can get into every little nook and cranny and all the details, and you can figure it out. So, do those areas feel tight, Yana? Yeah, she says it feels tight.
So David, he used this the gravity body weight against his finger, and that's what the way he's doing his job.
No, it's not hard for me because I know the technique of how to do that, so it doesn't bother me any. But I can feel where her problems are, so it's going to really help me to warm it all up and to get in there and to figure out how to fix it. It's very easy, and it's going to really make a huge difference. I could spend 5 or 10 minutes on each side. It'd be a world of difference. So I don't know.
And next time, we keep working on that. I hope the scoliosis lady will comes up and you will see the true scoliosis. And like I said, I got 3-4 exercises in my home library, which is we're going to show you next time how to do those home exercise for your scoliosis. But the idea is if you're shifted from one side, you're just strengthening one side. You make that side stronger. Because the problem is in scoliosis, like I said, one group of muscle is overloaded and one is weak. So you need to strengthen your weak muscle. You don't need to stretch that overload muscle, because overload muscle, that's the muscle who holding the whole position in at least in maintaining your body. If you keep stretching that loading muscles, you're gonna hurt yourself more. You need to strengthening the weak muscle. We don't stretch muscle anymore.
So everyone's thinking stretch. I need my hamstrings stretched. I need everything stretched, and that's going to solve your problems. And that's not necessarily true. It doesn't work like that.
It's like stretching classes. You stretch the whole body. No, you can't stretch the whole body. You have to train your whole body. And don't forget to work on the fascia. We didn't show this time, but I'll show you the next time where you check the fascia. Remember, those kinetic line. This is where's that fascia usually stuck. If this, you have to check that kinetic line and work always on that stuck fascia, because it's make a big difference in person posture and just movements. You guys have a good day.
All right. Bye.